Turning back to the pandemic now, as provinces, including Ontario, ramp up their reopening plans, there are warnings that to get out of this pandemic and prevent the next, workers will need improved protections. For workers at risk, like people working in healthcare, that means better masks. Researchers and advocates are urging workplaces and governments to provide better masks for their workers. Christalee Ramlakan has more.
Most of us have been wearing cloth or surgical masks during this pandemic, but a retired research scientist says they just don't do enough to truly protect against COVID-19.
They do some good in terms of source control, but in terms of protecting the wearer, because there is no good seal to the face, particles can travel with the air that's inhaled around the edges of the mask.
Smith says workers at risk should instead use true respirators. N95s like this one are the most popular, but Smith says reusable respirators such as elastomeric respirators could also work. But workers have experienced pushback when it comes to getting any kind of respirator, mostly due to directives stating that they should only be used during high-risk activities that generate aerosols. The Ontario government acquired 100,000 elastomeric masks last June, but union representatives say they still haven't seen them in use. The Ministry of Health says they were made available to long-term care homes and have distributed 22,000 of them. It also says it has close to 100,000 elastomeric respirators and intends to keep them as part of an ongoing PPE stockpile strategy. The Ontario Nurses Association is currently engaged in a court battle with the province over access to better PPE. We spoke with a doctor in Ottawa who has been calling for better airborne precautions.
I don't actually know of anyone who's wearing an elastomeric respirator at the hospital. The problem with an elastomeric is that it's very unknown to the healthcare setting. We're not used to it. It looks different.
We also spoke to an occupational hygienist who is part of a coalition of specialists that's been pushing for stronger COVID-19 precautions. Dorothy Wigmore says it should be assumed airborne transmission can happen. That means using respirators all the time.
There's no excuse for not giving those who need them real respirators. And this doesn't just include healthcare workers. It includes anyone who is in an enclosed space with a number of people for, something beyond a few minutes.
We also reached out to Health Canada about this. The agency says it's learning lessons from the COVID-19 pandemic, and that will inform what goes into the national stockpile of masks and PPE in the future.
All right, Christalee, thanks for this.